And we're really pleased to be able to offer this continuing education workshop for you today. For those of you that are not familiar with Harmony, we are a program located in Estes Park, Colorado that treats individuals 18 and over with substance use disorder. We do believe that long-term recovery from alcohol and other drugs is possible. How do we do it? As a place between two worlds, our location in the Rockies provides a safe and quiet respite from the pain of addiction. With 47 years of treating addiction, we've fostered a generation of long-term recovery who supports our clients and families for a lifetime. Harmony staff at all levels of the organization work together to create a community of recovery support that is long-lasting. Again, we are a 70-plus bed residential treatment program offering a full continuum of care beginning at detox through transitional living. We are 12-step based, evidence-based, and gender responsive. And if you're interested in learning more about Harmony Foundation, we invite you to visit us at harmonyfoundationinc.com. Or if you know someone who needs access to treatment right away, feel free to give us a call at 866-686-7867. Before we start our webinar, I just want to do a couple of housekeeping items to review. We will be offering one NADAC credit hour for this webinar today. We ask that you please be sure to complete the online evaluation at the end of the webinar. If you have registered through your email, you will receive an email response back with the evaluation. We ask that you complete that. Once we receive that, then you will receive an email version of your certificate. If you don't receive anything from us by Friday or the following Monday, please contact Christy Weeks at cweeks@harmonyfoundationinc.com. We would like to ask that as Dr. Braud is presenting today, to reserve questions towards the end. Feel free to ask questions in the question box that you will see on the right-hand side of your screen. And we will be happy to answer those questions towards the end of the presentation. So with that, I'm going to go ahead and introduce Dr. Braud. Dr. Braud is a medical director specializing in psychiatry. She has over 17 years of medical experience working with adolescents and young adults. In addition to her specialization in psychiatry, Dr. Braud is also certified in functional medicine. She is the medical director for Sandstone Care, and I do want to thank Sandstone Care for their partnership on this webinar today. And she also holds her own private practice. Dr. Braud performs psychiatric assessments and evaluations, manages medication, and collaborates closely with Sandstone Care's multidisciplinary team during treatment and discharge planning. And so with that, I'm going to go ahead and turn the presentation over to Dr. Braud.
Great. Thank you, Gina, and thanks to Harmony Foundation for the opportunity to do this presentation for everyone today. I was tasked with talking a little bit about integrative psychiatry and discuss how that can support well-being for teens, whether they are having issues or not. And while I was asked to talk about integrative medicine, I guess I did want to sort of put the highlight on functional medicine, which is my own sort of where my own heart is. But to take a wider lens for a moment and talk about that concept of integrative medicine or integrative psychiatry, that's kind of in my understanding something of an umbrella term, which would be used to describe a system of care, kind of uniting features of conventional care along with features of virtually any form of alternative medicine. So the term integrative might be used to describe combining conventional care with a practice of, say, mindfulness or energy medicine, acupuncture. Any of those kinds of things might apply to integrative care. Functional medicine in particular is itself integrative because functional medicine does rely on certain features of conventional care along with a unique paradigm for addressing the underlying causes of disease in a systematic and personalized way for folks. Here's the the functional medicine tree, which I think is a lovely graphic for sort of explaining what is the difference between, you know, what we call functional medicine versus conventional medicine. Conventional care kind of operates out in the leaves, out in the upper reaches of the graphic, of the tree graphic. It's very focused on one area, very much related to organ systems and a diagnosis there. So an understanding of signs and symptoms that sort of lands you out here in the limbs, and often with care being siloed from one practice to another, especially when people have complex illness. As a differentiation, you know, the most important thing that we do in functional medicine is really understands what's going way down here in the roots, looking at all the underlying and contributing factors, genetics, environment, history of trauma, relationships, stress, nutrition, sleep. Really trying to understand these underlying causes and understand how they might contribute to an imbalance in a person's life or their body. The clinical matrix is another tool that we use in functional medicine, looking at these various lifestyle factors again, which are there on the bottom, and today we're going to launch in and talk a little bit further about the nutrition and hydration quadrant. But the clinical imbalances, issues with assimilation, defense and repair, structural integrity, communication, those are all the things that the functional medicine practitioner is trying to understand, as well as in gathering a complete history, understanding the antecedents. That includes genetic history, family history, triggering events, traumas or other type of events in the person's life, and other mediators or perpetuators, exposures and the like, which would contribute there. Here on this slide featuring the matrix, to give some examples of what we're talking about when we look at, for example, assimilation. We're talking about the process of digestion and absorption, trying to understand what's going on with the GI microbiome or respiration. Defense and repair, in particular, we're talking about the function of the immune system, the presence of inflammation, the presence of infection. Communication is another another node that's very important in understanding brain health, because there we're capturing neurotransmitters or hormonal function of the body. So taking a further dive and looking more at the node of nutrition and hydration. The standard American diet is also known as the SAD diet, and it is indeed pretty much of something of a sad story. It's a diet that's pretty much high in sugar and high in vegetable oils, which by their nature are pretty much all rancid and oxidized. It's a diet that's very high in caloric density, but quite low in nutrient density. And it is one of the major drivers, if not the major driver, behind all chronic illness that we see in the United States and in the rest of the developed world, for that matter. So how are adolescents in our country doing relative to nutrition status? We know from studies that they fail to meet dietary recommendations for overall nutritional status and for specific nutrient intakes. Many adolescents are receiving a higher proportion of their energy from fat or sugar, while having a lower intake of several important nutrients: vitamin A, folic acid, fiber, iron, calcium, vitamin D, and zinc. Vitamin D deficiency is extremely prevalent. I pretty much never find anybody whose vitamin D level is in the adequate range unless they are already supplementing. And vitamin D deficiency is associated with bone problems, fracture risk, but is also associated with dysfunction in the immune system, notably. And iron deficiency is particularly important if we're talking about the health of the teen brain as it relates to the ability to pay attention, to have drive and motivation. And low calcium intake, of course, would increase the risk for fractures both during adolescence and the risk of osteoporosis later in life. The impact on health and diet has certainly been looked at by a few researchers. The principal researcher on this paper, Felice Jacka, has been writing about this topic for many years, and we'll see another seminal work by this group in a few moments. In this study, they looked at diet scores at a baseline point and then followed this group over time. Higher healthy diet scores predicted higher scores at follow-up, while unhealthy diet scores predicted lower scores in the quality of life. And improvements in diet quality were mirrored by improvements in mental health over the follow-up period, while the opposite was true for deteriorating diet quality. And this from their conclusions regarding the pathways by which an unhealthy diet is impacting the risk of mental health problems. Fruits, vegetables, and other aspects of a healthy diet contain important nutrients: folate, magnesium, the B vitamins, selenium, zinc, healthy, particularly monounsaturated fats and some polyunsaturated fatty acids, and fiber. These are known to be important as it relates to depressive illness, and more importantly, on a we're now understanding more and more exactly how they're operating within the body, exactly how they're reflecting the oxidative balance or redox status, how they're impacting the functioning of the immune system, and aberrations in these systems are increasingly being understood as underlying depressive illness. Here was another look, this focusing on intake of B vitamins, where lower intakes of several of the B vitamins being associated with mental health problems in adolescents. Here's a look at omega-3 fatty acid and nutrient deficits. These are just taken for some of the openings of this paper. It actually is a very well-written paper, not only looking at some of the underlying factors, but then going into and examining many of the studies that have been done in the area of omega-3 fatty acids and childhood behavior disorders, ADHD, and depression disorder. It was a very good review article of the research in this field. In the United States, most Americans have very high intake of omega-6 linoleic acid. It's abundant in vegetable oils like corn and soybean oil. While they have relatively low intakes of omega-3 linoleic acid, and that high intake of omega-6 can prevent the conversion of omega-3 plant-based linolenic, ALA, to EPA and DHA. That high omega-6 intake also creates a pro-inflammatory status in the body, and therefore competing with these anti-inflammatory omega-3 compounds. So to just kind of recap that, high levels of omega-6 fats and relatively lower levels of omega-3 fats have been found in children and teens with ADHD and depression, and that is true for adults as well. And And the negative impact of exactly what these omega-6 fats do, I think is being greater appreciated. Something that I've just been exposed to myself, a book by Kate Shanahan, a family practice doctor, Deep Nutrition. She is explaining at great length the manner in which these fats are creating havoc in our cells and in our bodies. One of the ways that non-desirable fats like vegetable oils pose risk is through the formation of trans fatty acids, which happens when they're oxidized. This study from Spain looked at the intake of trans fats in a cohort followed over time and found that the magnitude of risk with a high trans fat intake and depression was quite robust. And this probably due as far as mechanism because of the alterations in the immune system, a rise in pro-inflammatory cytokines or messengers, and alterations in the endothelium or the lining of the blood vessels. And so the risk, just like there's an increased risk of cardiovascular disease with a high trans fatty acid intake, some of the same mechanisms could be contributing to its risk on depression. And in this study, they highlighted the fact that the Spanish population that they were examining was one where the trans fatty acid intake was actually much lower than it is for the average American. These folks were getting trans fats primarily from dairy, just a small amount of trans fats that are made in a natural product like cheese or milk, whereas here in the United States, our intake of trans fatty acids are artificial foods and hydrogenated vegetable oils. And then finally, one other area of our poor diet choices, looking at the impact of artificial food colors. This study from 2012 found that artificial food colors can have a negative impact on children's behavior, whether or not they have a diagnosable brain condition or ADHD, and that there just may be an aggregated effect on the classroom when the majority of children are being exposed to artificial food colorings. So we see a couple of different ways in which nutrition and nutrition choices can have a deleterious impact on depression and on mental health functioning. Do we have any evidence that eating differently or having a better diet can make a difference? And this is pretty exciting news. The SMILES trial, there were write-ups in several magazines about this. The paper itself is open access so that you can get the entire paper if you'd like to look at it. But this was really a first of its kind group where a group was followed in a randomized fashion, single blind, they did not do a double blind, where there were two different interventions, one consisting of individualized nutrition consulting, and the control condition was a social support protocol with the same number of visits and length. 31 in the diet support group and 25 in the social support group completed the 12-week study, with the dietary support group demonstrating significantly greater improvement between baseline and 12 weeks. So the evidence is emerging that diet can definitely make a difference in impacting symptoms of depression. And this study, as I noted earlier, from Felice Jacka, this is the same group in Australia, I believe, who've been doing lots of work in this area for a number of years. What about if we improve diet or improve nutritional status, not so much through diet, but the use of supplements? And this is something that's been looked at, again, a number of times in various studies. Here, looking at juvenile delinquency symptoms, where children received either an active supplement or a placebo, and those children, over the course of the study, were disciplined 47% lower times than the other children, which is quite notable. And the poor nutritional habits that might lead to low concentration of the water-soluble vitamins like the B vitamins, which can then have a direct impact on antisocial behavior and or violence. And that's the reference for that particular paper. So, so I wanted to just spend a few moments just talking a little bit about some of the ideas and some of the ways that we can sell healthy to kids, which is, I mean, I totally understand that to be something of a challenge. In my private practice, where I work both with adults as well as with children and teenagers, I definitely find the adolescents to be the toughest group. The children are usually at the, their parents can kind of feed them whatever they want. My adult patients who are truly looking to pursue alternative medicine or functional medicine are usually highly motivated to make dietary changes for themselves. The adolescents are sort of the hardest group to work up against. One of the things is, you know, kind of understanding those developmental stages, understanding what motivates a teenager to change their health habits, encouraging them to, as it might relate to skin health and improving acne or athletic performance, is probably two of the key motivational things that I can think of. Letting them come to you and avoiding lecturing too much while you work on the home environment. You know, it's really important for parents to serve as role models and set the environment of the home with as many healthy choices as possible. Understanding that when the adolescent is outside of the home, that they may not be making quite the same choices, but not necessarily making a big deal of that either. And then some of the actual things that you can do in your own kitchen, hiding veggies in certain things, doing enough prep so that vegetables and fruits are easy to access, making healthier fries at home instead of deep frying things, just baking and roasting potatoes or sweet potatoes, using the blender or the juicer to make smoothies, and getting everybody involved in shopping, cooking, and eating together. Because if they have a role in what's being served, they might do a little better job at eating those veggies. Part of our objectives today was to also cover a little bit of the role of the digestion and assimilation node as it relates to mental health and potentially to substance abuse. So this is an area where there have just been lots and lots of advances just in the last few years. And so we're now becoming to have a better understanding upon this very important relationship between the brain and the digestive system, which is really a reciprocal relationship. So that, you know, from the top down, in depression, digestive function can be suppressed. Stress also significantly has a negative impact on the normal function of the digestive tract. And there are just so many factors that are kind of coming together to impact the function of the digestive tract. It can be kind of as simple as not taking adequate time to focus upon eating and instead eating on the run, eating while working, which I know many of us adults are very guilty of. Heavy use of antibiotics can have a negative impact on digestive function. Many of our teens might be using antibiotics orally to control acne. Other stressors or traumas can disrupt the balance of microbes in the gut. Low fiber intake has an impact on the digestive function. It has a big impact on the microbial balance. And inconsistent elimination or constipation can have a big impact. I just saw a boy this week who he got kind of scared into improving his diet after a trip to the emergency room for what was determined to be just a bout of constipation, but I guess he was having pretty significant abdominal pain. As it relates to substance abuse, stimulant abuse definitely compromises digestive function. As you know, it's just this massive state of arousal akin to stress on steroids, and so the impact of stimulant abuse that we see in the methamphetamine user's mouth. I mean, it starts at the mouth and it goes throughout the digestive tract. The impact of alcohol on the digestive tract is quite interesting and maybe a little complicated to some of you, but the impact of alcohol is directly impacting the bacterial makeup of the gut. These gram-negative bacteria, which release endotoxin or a pretty significant poison, which can end up getting directly into circulation. So it's this pretty elaborate mechanism by which alcohol damages the intestinal wall, can then induce damage to the liver. It can induce inflammatory response in the liver TNF-alpha, lead to endotoxin in circulation, which would promote a systemic immune system response. This was the previous slide was from this paper, a summary of a symposium. So again, as we think about this concept of looking at digestive function, it's definitely receiving a lot of interest, even as it relates to alcohol, not only depression and other mental illnesses. Another node on the matrix that was part of our objectives for today was looking at the role of food and food sensitivities, and we can't talk about that without talking about the inflammation node, defense and repair. So when in the last 10 or so years, it's come to be understood that there's altered immune system activity found in depression, other mental illnesses, and in substance abuse as well. So there are elevated levels of various cytokines that can be found in the bloodstream in people suffering from these conditions. These cytokines or markers have lots of impact, and one of the things that I will use as an example in talking to patients is, just tiny amounts of these markers, if given to a healthy animal, will immediately induce what's known as sickness behavior. So the animal will go from its normal exploring, engaged with its environment, to basically withdrawing and kind of isolating itself in a corner. And again, it really doesn't take much to induce this. Some of the factors that are promoting inflammation in our lives today, diets high in sugary foods diets high in vegetable oil, that altered microbiome or digestive issues, chronic infection, and several nutritional deficiencies, notably zinc, the omega-3 fats, and vitamin D can alter the immune system function. And then those common foods as well. To talk about, when we talk about inflammation as it relates to foods, we're typically not talking about food allergies. Food allergies are mediated by IgE or antibody E in the body, and typically this is a fast acting kind of process, so that a person has an immediate response to exposure to strawberries or peanuts. Sometimes eggs are known to cause this type of food allergy. And typically these people know that they have that response and are actively trying to avoid those foods. They might have an EpiPen in case of accidental exposure to one of those foods, but usually that's a known thing, or it can be easily determined with a variety of allergy tests. When we're talking about food sensitivities, we're talking about an immune response that happens very slowly. And because these foods are often constantly in the diet, or often enough that there really is no kind of realizing that it's the food that's causing the fatigue, or if the food that's contributing to mood problems or even psychosis is possible. So it takes a little bit more investigation to usually discover what's going on with a food sensitivity. The foods that are known to be the biggest problem are gluten intolerance, or gluten and casein or milk. With regard to gluten, celiac disease, which has increased and recognition of it has increased, is on the rise. But then there's non-celiac gluten sensitivity, which is very much a real phenomenon and can be detected. And then intolerance to dairy proteins, which is different than lactose intolerance. Lactose intolerance implies merely that you're not digesting the sugars well, versus casein intolerance, where you're having an immune reaction to those proteins. This paper, Bread and Other Edible Agents of Mental Disease, was a very, very well written and actually very readable. It was written in layperson's term, not neuroimmune scientist terms, and talking about all of the different mechanisms by which bread or gluten or wheat can impact the digestive function. And one of the things that's becoming understood is that that gluten or wheat kind of makes the gut more permeable in almost any individual, and in certain individuals that's going to be so severe that that the immune system begins to attack those food particles. It might attack the brain because of the resemblance between those food particles and structures in the brain, and then the creation of opioid-like compounds, which can cause mental derangement or kind of fogginess in certain individuals. And advocating that that a grain-fed diet might improve the mental health of many people affected. So how do we go about addressing concerns about a food intolerance or a possible food intolerance? The elimination diet is really the gold standard, and that's where we eliminate a single food, or more often eliminate several foods at once from the diet for a period of about 4 weeks, and it can be longer. Some programs across the country are now doing this as a routine in their programs, in their kitchens. on the I provide supervision to a program, another program in Estes Park that works with teens and adolescents, and our kitchen there is gluten-free and dairy-free. There are varieties of tests that can be performed to look for food sensitivities. This is different than looking for food allergies. And they can be helpful. They can be helpful in particular for the skeptical patient who maybe wants some type of proof that they should do any type of dietary change. When the person's gut is compromised, when the person has leaky gut, the results of those lab tests can be kind of skewed, and it may look like a whole bunch of foods or a problem when in fact it was really only one or two primary foods that created the issue. But in the basics of the elimination diet, what we want to see happen is that any and all of the offending foods are removed as completely as possible. And that's a really key point, that a little bit going in during this elimination diet trial will continue to provoke the immune system, and we won't be able to see the results that we're looking to see. So quite complete removal, allowing the immune system to quiet down, allowing the gut to start to heal itself, and then after a period of 4 weeks, maybe longer, maybe 8 weeks or even 12 weeks, all of the foods are reintroduced as slowly and carefully as possible, because what we're really wanting to do here is to be able to observe what happens as these foods are reintroduced. So, one food every week, have a good dose of it, wait a few days, see what happens before going on to the next food, so that we can look at how the body is being impacted. And finally, the last thing that I wanted to cover today was to just look at some of the things that I do for basic supplementation in my practice. I've got all of those things here on this slide in a summary, using a B complex, omega-3 fats, magnesium, a broad spectrum probiotic, and vitamin D. And I've got a little bit more information about each of those points on the subsequent slides here. So looking at that B complex, it should contain the active form of folate, which is also known as methylfolate. The label should not say folic acid. And the active form of B12, which is known as methylcobalamin, as opposed to cyanocobalamin, will be in many B complexes and multivitamins of lesser quality. And typically the amount that we're looking for is to do something called a B50 complex. And this type of supplement has a 50 milligram dose of vitamins B1, 2, 3, 5, and 6. The doses that are used of folate and B12 they're dosed very differently, so there's not a whole 50 milligrams of those in a B50 complex. In addition to that B complex, it can sometimes be helpful in certain circumstances to use higher doses of folate, B6, and B12, though usually I will do that based on a person's testing, laboratory testing. The omega-3 fats come from fatty fish, wild-caught salmon, or fish oil supplements. It certainly can be helpful to eat more of that type of wild-caught fish. Or my recommendations, and this would include how I supplement for my teenage patients, giving them 1,000 milligrams of EPA and 500 to 1,000 milligrams of DHA. It is possible to get vegan sources of omega-3 fats. Alpha-linolenic acid can come from flax and algae. DHA can come from seaweed or algae sources. However, there can be problems with not converting that plant-based omega-3 fat into the EPA that is needed in the human body. And if using algae-based DHA can be converted somewhat into EPA, but in the human, that efficiency may not really be there. And measuring blood levels would probably be the best way to know how you're doing on your omega-3 intake. Some people are using krill oil and advocate that it's superior to fish oil, and that perhaps lower doses of EPA and DHA might be used and might result in good blood levels. For myself, in my own practice, I pretty much continue to use fish oil at this point. Magnesium is just a super important nutrient for the brain and the body. We're looking to dose it basically in as high a dose as the person can tolerate, or just under what is known as their bowel tolerance, so that if they take much more than that, they'll have loose stools. So there can be a lot of variety in what a person can tolerate. It might be as little as 250 milligrams only once per day, and whereas other people can tolerate 500 milligrams 2 times a day. One of the dose forms that I like to use is magnesium citrate as an effervescent powder, and because the dose is easily adjusted. Magnesium is acting on many levels on the hormonal axis and regulation of the stress response. It can act at the blood-brain barrier and prevent the entrance of stress hormones into the brain. Magnesium deficiency is associated with inflammation and with alterations in the immune response, as we see in depression. A broad-spectrum probiotic, and by broad spectrum, we're wanting to see multiple strains of organism in the product, not merely Lactobacillus acidophilus or only one organism. There are still some products out there like that. And the dose can be vary, kind of consistent with the level of digestive symptoms that are present or the level of antibiotic use that's been present. So a lower dose, kind of more of a maintenance dose, would be in the range of 10 billion organisms or 15 billion organisms. Or if somebody is having lots of digestive symptoms, or if they've had heavy or recent antibiotic exposure, that dose might go as high as 350 billion organisms. Other ways that we can get support the digestive tract is learning to eat fermented foods like sauerkraut or fermented pickles, which are yummy. And as I mentioned here, antibiotic use would indicate the need for higher probiotic. For vitamin D, we basically want to use vitamin D and track our levels. So the dose of vitamin D needs to be sufficient to achieve a level of between 50 to 70. And depending upon the size of the individual, this may be as high as 5,000 IUs as a maintenance dose. If a person's level is low, doses up to 50,000 IUs once or twice a week can help restore the body's stores safely and more rapidly than kind of waiting for a lower dose to get up to speed. And using a higher dose kind of less often might help with convincing a kiddo to take some supplements and when they don't have to take it all the time. One of the nice things about vitamin D is that there are numerous types of preparations out there. Some are liquids and might have 2,000 IUs in just a single drop, so they're pretty easy to get down. I think I'm doing okay on time here. Gina hasn't come in to have me stop. I did include some stuff a little bit here, just real briefly, on using amino acids to target brain symptoms, which I think can be particularly relevant when we're talking about recovery, and especially early recovery and relapse prevention. The concept being that the amino acids tryptophan and phenylalanine are the precursors to brain chemicals, serotonin, and the catecholamines, dopamine, norepinephrine, and epinephrine. These were actually being studied quite actively in the era prior to Prozac. In the field of recovery, Dr. Kenneth Bloom has pioneered work in this field and work related to the genetics of addiction. And more details about using amino acids can be found in books by Julia Ross and Joan Matthews Larson, as well as others. Just to give a little bit more detail here, L-tryptophan is the precursor to serotonin, and it is available as a supplement in two different forms, as L-tryptophan, which can become serotonin as well as other things, and 5-HTP, and the only outcome of using 5-HTP is the creation of serotonin. L-phenylalanine is the essential amino acid, which is the precursor to L-tyrosine. So we can manufacture L-tyrosine from L-phenylalanine, but L-tyrosine goes on directly to make dopamine, norepinephrine, and epinephrine. And we can supplement with either form, with D-L-phenylalanine or L-tyrosine. And lastly, we can use amino acid therapy. We can use certain supplements which influence GABA signaling. GABA is the brain's other main calming signal. And GABA signaling can be supported actually with a number of nutrients, which includes GABA, but also includes glycine, taurine, inositol, and L-theanine. And here are some more resources for getting some additional information about functional medicine or integrative psychiatry. I'm sure there's a mechanism for taking questions that I don't know how to do. And my apologies, this is my first time doing this. If you'll just bear with me one moment while I get my technological help here. Okay, this is awkward. I'm going to try to minimize this and see if I can take your questions. Because I did go through those slides pretty quickly, which is what I do when I talk too fast. So I got through all of my slides and I did not know what to do. And okay. I talk fast.
Thank you, Dr. Braud, for your time today. We really appreciate it. For those of you that are interested in having access to her slide deck, we will make it available to you. And does anyone have any specific questions for Dr. Braud today? Okay. If you have any questions following the webinar and you would like to reach out, feel free to contact us. Our information is available at gthorne@harmonyfoundationinc.com. We will make the slide deck available, and please look for the email with the evaluation form, and we'll be happy to send you certificates within the next couple of days. Thank you all, and have a great day.